Welcome everyone to the Rural Health Alliance Access to Specialty Care interest group. It's been an interest group forever, from the start of the Rural Health Alliance back in 2009, because in many communities that don't have pathways to specialty care, they do have pathways to primary care, even though I understand that's getting even tougher. But with HCPF's new program, Healthcare Policy and Financing, on the eConsult platform, we just asked that, and they were so gracious in coming and giving us an update on any progress and successes and problems as they proceed. Any new perspectives on the eConsult program, still scheduled for February question. And then follow up maybe with what we might do as we implement this program to handle the tough issue of in-person specialty care, if that comes out of the eConsult program. So Matt, turn it over to you.
Yeah, thanks, Rich. And so what we'd like to do today, and because I assume there are some folks in the meeting today who haven't been in previous meetings, so we'd like to quickly go through and give some background on the eConsult program like we have previously. So forgive us if you've seen this before, and then we'd also like to provide an update, as Rich said, on sort of where we are. We've had some pretty major policy developments as a result of stakeholder feedback over the last month or so. So we'd like to share some of those developments with you, and then of course field any questions that you might have. So I am battling a bit of a cold, so I'm gonna hand it off to Abby quickly, and again we'll answer any questions you have at the end. So Abby, do you want to go ahead and introduce yourself?
Hi, good morning, everybody. Thank you so much for being here. And I'm new to HCPF. I'm super excited to be here and present our updates to you on Colorado Medicaid eConsult. Just like Rich said, we are really excited to provide an opportunity to improve pathways to specialty care. And that's what we're here to talk about today. So we're going to go over just some general eConsult information, recent highlights, provider compensation, single sign-on options, and electronic health record or health information exchange integration, specialty provider participation, specialty field availability, routing of eConsults, and provider training and a timeline. Next slide, please.
Great.
So eConsults, I'm sorry.
No, I said, you're right. That's a nice areas to delve into. Thanks, Abby.
Oh, sure. Yeah, no problem. So our eConsults are providing asynchronous, meaning store and forward electronic clinical communications between a primary care medical provider and a specialty provider. And these eConsults allow primary care medical providers to submit electronic clinical questions through an eConsult platform to specialty providers without having to submit a referral when they feel that they can't provide the direct specialty care a member needs during an appointment. So what's been going on with our project here? In May of 2023, CMS approved our contract, and then our contract was awarded to our vendor, SafetyNet Connect. And we've been working very closely with them on design and implementation activities. We are still scheduled to go live on February 1st of 2024 under the name Colorado Medicaid eConsult, and that can primarily be accessed through this URL, coloradomedicaideconsult.com. So what we're hoping to do here, other than improving pathways to access for specialty care for our members, is to empower providers. For primary care medical providers, we're hoping to provide enhanced access to specialized expertise, streamline care coordination, collaborate on the management of complex members, and accelerate response times for care management. Specialty providers, we're looking to expand their reach of expertise across a larger care population. We're decreasing waiting periods and minimizing appointment no-shows. And there will be opportunities for teaching and sharing best practices with PCMPs and reducing unnecessary or inappropriate referrals. And all of this together encompasses the improved ability to meet provider needs while improving specialized access for members. Compensation for providers. So this is exciting for us. This platform is free to all qualified providers and practices that are in the state of Colorado and enrolled as Health First Colorado providers. For primary care medical providers, we're anticipating approximately $17 reimbursement for a completed eConsult, and specialty providers approximately $35 per completed eConsult. Single sign-on is an option that our providers are welcome to explore with our vendor, Safety Net Connect. This platform will be accessible for free to all Health First Colorado PCMPs through our web portal. But as part of the enrollment and onboarding process for those PCMPs, we are offering multifaceted single sign-on capabilities, and also including working with those provider EHRs and HIE systems. Specialty provider participation. All specialty providers must be enrolled as a Health First Colorado provider and licensed to practice in the state of Colorado. The specialty providers also must contract with the contractor to participate in the eConsult program. And the contractor is responsible for training and quality performance of the specialty providers. The contractor is responsible for making the direct payments to specialty providers as well upon the completion of an eConsult. And if you're interested in participating as a specialty provider, please feel free to reach out to us via this email address that's linked in the PowerPoint. So these are the available specialty fields. It's about 40 fields and counting that we're anticipating to be available at Go Live. So we've got adult specialties and pediatric specialties, and we're really excited to be able to offer specialty advice from all of these different fields. Routing of eConsults. So one thing that we have chosen to prioritize is PCMP choice in selecting the specialty provider that they want to work with. So if that specialty provider that they want to work with is at capacity and not able to accept a new eConsult, there is an opportunity to send that to the next available specialty provider. And this approach fosters provider relationships, widens our network, and benefits member access to specialty services. The PCMPs can review the specialty provider contact cards before they select who they want to work with, and that will include a picture, specialty name, title, and resume or CV links. Provider training. The contractor will provide several different types of training options as part of this onboarding process. So we will have live web-based training sessions, recorded videos, and e-learning tools, as well as written documentation in the form of a user guide. And then training is essential and will be required for providers who are going to use our platform. Our contractor is going to provide robust training to enhance user adoption for long-term eConsult submission success. And time can vary for submission for an eConsult for each provider, but we're anticipating that it should be pretty easy and fit into existing workflows. Just a little timeline here to let you know where we're at. So you can see here where we're kicking everything off in May, and then we're in this August to February region currently with design, stakeholder engagement, provider training, and just preparing for that go live in February. So we do have some recent policy updates. I'm going to kick it over to Matt Lanphier to talk about those with you guys and take questions.
Yeah, so this is just some newer developments. They're still pretty fresh, so I'll just give you some sort of high level bullet points here, and this should all be new since the last time we met with you all. Along with the routing of the eConsult, we talked a little bit about how that would work last time, and so some of that is new. But also we are exploring allowing fee-for-service billing outside of our platform. So the way that this was designed initially was that providers would be required to use our platform in order to receive reimbursement. We've received some stakeholder feedback, specifically from providers that already have platforms that they're using internally on their systems. And essentially, this would disrupt those workflows, and in order to better align with what commercial and Medicare are doing as well. We are exploring that, and what exactly that looks like is still a little bit TBD. I think there will be some I think parameters around what will be allowed to be billed, from platforms outside our own, and what and how we would consider a non-department platform to be approved. But that is something that is in the works, along with adjusting reimbursement rates specifically to align with what Medicare is paying. When we initially submitted our budget request for this program, it was 3 or 4 years ago, and so I think at least one of those rates might be a little bit out of sync with what Medicare is paying. So we do expect to go through that process to increase that rate. That still is subject, to the budgetary process. So it's that would be something that would not be in effect until the earliest of I think July of 2025. And then the last thing is allowing between specialty consults. So that would be, right now the way we have designed is just from a primary care provider, PCNP, to a specialty provider. And we've heard some feedback that we would like to allow some functionality for specialty providers to consult with each other as well. And so we're exploring adding that functionality as well. Are there any questions?
I have a question about the specialty to specialty e-consults. Can you talk about a little bit more, or provide an example of what that looks like? Is that folks in Colorado who are seeing patients in person, as well as doing an e-consult and asynchronous consult with another specialist through the platform, or what does that look like? Thanks.
Yeah, so I think there's probably multiple use cases there, and so this, I think, again, this is probably something that we need to flesh out a little bit more as to what exactly that looks like. But yeah, I could see, a use case exactly like what you talked about, a specialty provider in Colorado, in order to manage the care of the patient, that's, that may be just outside the scope of their expertise, consulting with a specialty provider that's available on the platform, in order to manage the care of that patient themselves. And then also, for consults that are already, sort of in process on the platform, allowing the routing of those between, from one specialty provider, saying, hey, this is outside of my area of expertise. Let's loop in, a different subspecialty that may be able to help.
So it's possible that a primary care provider submitting an e-consult request through the platform for, say, neurology, gets feedback from the specialist. Oh, this is actually a gastro issue, not a. I'm obviously not in medicine.
Right. Yeah.
And then you could hold that and then route it to the other specialist if it's not appropriate too.
Right.
Okay, cool.
And the way that that works right now is it wouldn't necessarily be routed to another specialty. It would be closed and considered a separate e-consult.
Okay.
Is the way that we have it currently. So I think the primary use case would be, the first one that we talked about.
Okay.
So yeah.
No problem. This is Beth from Denver Health. I just wanted to say thank you to the eConsult group for making workflows easier for us. And I was going to give an example of specialty to specialty that happens, like a patient that's in already oncology, but they start developing issues cardiovascularly or something like that, then the specialist in oncology may do an e-consult to cardiology and say, hey, this patient's, getting chemo right now, but they're starting to have issues. So I just want to give that example.
Thank you.
Thank you.
So I heard a little bit about the resources you all are providing to get providers trained. I was wondering what the average time commitment you foresee that being, either annually or however you see it.
Time commitment on the part of the primary care providers or the specialty providers. I don't anticipate the platform itself is not particularly complex. I think, I would say it would probably be, on the order of 2 to 5 hours total training time, which our vendor plans, to do most of that, at least for the initial batch of participating providers during the month of January. But that'll be sort of the initial training, and then again, all of the we'll have continuous training opportunities available on the website. There'll be recorded webinars, provider manuals, and all that stuff as well.
Awesome. Thank you very much.
Yeah, for sure.
I'm kind of curious if you've had conversations on the type of outreach they're going to be doing in order to kind of recruit new specialists into this kind of platform. Because oftentimes certain specialists are like, well, this is probably not going to be the route, and I don't really want to take this time. So I'm just kind of curious as to that type of outreach that either HCPF is going to do or Safety Net Connect is going to do.
Yeah, it's a great question. And actually, so I don't know that we've talked about this a ton, but the way that we have the program structured, actually, Safety Net Connect is subcontracted, or I should say, ConfirmEd, which has a national network of specialty providers, is a subcontractor of our Safety Net Connect, our vendor. So we have and they already operate a pilot program here in Colorado with Rocky Mountain Health Plans. So we have the benefit of already having an established network of some specialty providers. It's not going to be the full spectrum of what we showed you on the slide there, but we do have, I want to say 10 or 15 specialty already existing in Colorado. And then they're conducting, in addition to that, they have a national network of providers that, will obviously have to be enrolled with Health First Colorado and licensed to practice in the state of Colorado. But they are able to sort of backfill that. And so it's an already existing network that's sort of able to backfill any deficiencies we have in the Colorado-based network. And, initially while we ramp up that Colorado-based network as well. And then they're conducting outreach via email and telephone to those specialty providers using provider data that we've supplied them for our specialty for the network of specialty providers that are enrolled with us. Does that answer your question?
Yeah, great. And I was wondering if I could ask one last question. And this is in terms of more of an example. So let's just say a primary care physician is interacting with a dermatologist, and they need a photo of a specific mole. and they don't have the technology to, take high definition photos of that specific mole. How can like small clinics, is there any type of assistance in which those small clinics can um, go towards in order to kind of help them out with these types of purchases? Because I know there's special cameras for retinopathy as well as some other, cool medical tools. So, but they can be a little pricey at times.
Yeah, so I don't know that I can answer that question because it's sort of outside this scope. We don't have anything, in the platform itself that allows for any sort of or within the scope of the project that allows for any sort of funding opportunities for anything like that. The only thing I would say is that the platform does have the ability to obviously capture that those pictures and what have you, and send it in to the specialty reviewer in that format, but that would be an onus on the primary care provider that they have the appropriate equipment to capture that.
Great, thank you.
Yep.
So a question for Matt, Abby. You're obviously getting feedback on the new platform. Is it coming back as being supportive? Like I think you mentioned that, Matt, that some specialists may say, it's not necessarily something that I would do. Are you getting specialists? Are you seeing signs that they would join such a program, and as well as primary care, that they want to be part of the program? What do you think?
Yeah, we are receiving, I think, quite a bit of feedback. I think, providers are particularly excited in our rural areas, in the Eastern Plains and of course the Western Slope, where they don't have as much access to specialty care. So I think that's, going to be, and we do plan on, sort of incorporating some of that feedback into some of our future presentations, and we can certainly send you all a link to our planned future presentations, because we have a whole we have at least, I think, I want to say 3 stakeholder presentations in the next month, and then we're starting into our webinar season, so to speak, beginning December, end of November, December, January, where we will dive into some of this stuff in a little bit more detail. And so we're planning on bringing some testimonials from providers who have used this system already or a variation of it. Again, there's a pilot program with Safety Net Connect on the Western Slope, and providers there have found it particularly useful. And so we'll be, attempting to capture some of their feedback for our audiences as well.
Since we have so many people from CU Medicine on this meeting, I'm curious if, and especially since it's in Aurora, allowing the fee-for-service eConsult reimbursement outside of the platform, is that meeting the needs of CU Medicine, or do you foresee CU Medicine folks a lot of use through the platform? I'm just curious, put you on the spot.
Yeah, that's all right, Mandy. I'm happy to try and take that.
Thanks, Aaron.
The allowance of that activity would certainly be beneficial, and allow for continued use of a platform that has been actually very effective and a lot of resources and infrastructure already established. What will be interesting to understand is if that particular, let's just call it CU homegrown platform, could continue to grow and extend beyond the traditional CU enterprise, meaning we already have several FQs aligned with the platform that includes Salud, Stride, Peak Vista, and certainly welcoming and potentially of others, but we would need to work with HCPF, Safety Net Connect, and the administrators to understand is if the allowance of the fee for service is that specific to internal PCP CU to internal PCP specialist? Or would we have a continued opportunity to leverage additional outside parties, or if that's going to be specifically directed through Safety Net Connect? So there's just, I think, a few intricacies that need to be managed through, but all in all, I think that's a positive outlook on leveraging existing systems throughout the state. And it's not specific to CU. I think you've got Denver Health and Hospital as well as Kaiser operating on some other platforms that have also shown some success.
Thanks, Aaron.
Yeah, this obviously it's going to be tricky. So I'm glad that you're starting out even in this month to reach out and allow folks to go to platforms to learn more about this Colorado Medicaid eConnect program. I think that's what Abby might have said is its name. Then the other trickier thing is, so a primary care has successful eConsult, and the specialist says, you know what, this particular condition, a specialist really needs to see this person in person, just to make sure that we've dotted the I's and crossed the T's in this complex condition that he or she has. Is there any thought on how that then might be handled by the new platform, or would we be back to what we're doing right now, crossing your fingers and calling people? Any thoughts on that, Matt or Abby?
Yeah, I mean, I would just say that at this time the platform does not have functionality to convert an eConsult into a face-to-face referral. It is functionality that Safety Net Connect has built into other iterations of their platform in other markets. So it's not, so it's something that we talked about. I think though our goal, at least with this first iteration, was to really just get the platform off the ground, and understanding that the use case here would not be necessarily for those complex members that would ultimately need a face-to-face referral. It would be more for those marginal cases where it's maybe just outside the scope of the primary care provider or the treating provider's scope, and they just need a little bit more information to manage that care for the member themselves, as opposed to converting that to a face-to-face referral. But it is something that we've talked about, explored, and I think it would just be a much bigger project than I think what we're looking at right now.
Additionally, Rich, I just wanted to also put out there that really what we're, just like Matt said, what we're trying to do here is to allow member care to take place within the primary care setting as much as possible. So if these primary care providers can reach out and get specialty guidance that allows them to continue to care for those members in their medical home, you can say that's a huge benefit to those members. But additionally, what we're doing is reducing the amount of kind of those one-off face-to-face referrals that take up a lot of time for specialists. And what we are really hoping to do is decrease median wait times for specialty visits that are face-to-face for those people that do really need it. And in my research and in my discussion with some of the other platforms that are already available in Colorado, what they're seeing is about 4 out of 5 of these eConsults that are being submitted and closed are able to be closed and managed within the primary medical care provider's care, and not resulting in a face-to-face referral. So what we're really hoping is that this program will reduce those median wait times and allow a much more convenient experience for those members who need a little bit of specialty guidance on their care management but they're able to stay with their primary care providers.
I appreciate that elaboration on this issue. Obviously, there will be some, 1 out of 4 cases where someone will need to see do an in-person visit. Does Safety Net Connect or maybe the CU system itself, it has mechanisms for, I think, as I heard a few minutes ago, to engage in a fruitful way, a face-to-face in the rare instance, quote, the rare instance that it may be needed. Any thoughts on that from Safety Net Connects, probably at a small scale, maybe with Rocky Mountain or somewhere? And does CU have that within their system, Aaron?
We do, Rich. We refer to it as an enhanced referral. So again, just given sort of the tight-knit community of providers and being within the same system, and obviously makes it a little bit more of a smooth transition. But when the provider determines that would be in the best interest of the patient to actually see a specialist in person, we then kind of move and advance towards the attempted scheduling and connectivity to that specialist. That also then comes with all the previous information shared by the PCP and generally results in lower testings and other activities that generally would be repeated when someone just goes fresh to a specialist without that prior communication.
This might be an appropriate time. I'm going to share my screen. The Aurora Health Alliance has received some funding from Kaiser to, I don't know if I can zoom in more, from Kaiser to plan and implement a convening to bring together healthcare systems and regional accountable entities in the metro area to, in a strategic way, discuss ways to leverage this rollout of the eConsult program, including creating a pooled resource for health systems or specialty care providers when that in-person appointment is deemed to be necessary after the eConsult. So not that we're going to solve, this is not the convening, not that we're going to be solving this, but we are working toward getting an in-person meeting with these key stakeholders from all the health systems to lean in, be engaged, and hopefully come up with a way that works for the local specialists to, I don't know, share in like spreading out the specialty care visits in an appropriate way, so the burden isn't all on one health system. So I do want to start talking about that at some point during this meeting, but it seemed like a good transition moment. That's what a lot of people on the side whispering in my ear are like, but what about the people who need the in-person visit? And I think what's being lost in that is the state's eConsult platform is going to reduce those wait times, and that is important. And the messaging for that is so important. But there is concern happening with folks, what about who's going to take the in-person visits then? So we've received funding to help facilitate that conversation.
Thanks, Mandy. I appreciate clarifying that. And I say this wonderful new program should reduce the waits. But it just, now that we have this, we want more type of thing. And I know you guys understand that. I know, as Aaron was saying, within health systems themselves, they have mechanisms for that. But now we're talking about interoperability of different health systems to really collaborate and work together and better.
Great. Thanks, everyone.
Thank you.
Thank you. Thank you
Thank
all.
you so much. Nice to meet you all.
You too. Thank you so much, Abby. Welcome aboard.
Thanks.